Good morning. It's May 21st, and this is your daily brief in science. Here's everything you need to know. A recent study led by the University of New South Wales has revealed a surprising shift in the calving patterns of humpback whales. Researchers found that humpback whale calves are now being born significantly further south than previously believed, with sightings extending to Tasmania, over 1,500 kilometers from traditional calving zones. This study was prompted by a sighting of a mother and her newborn calf in Newcastle Harbour in July 2023. Utilizing citizen science and historical data, researchers identified 209 records of newborn calves, including 11 confirmed births, noting a significant increase in sightings since 2016. As the Eastern Australia humpback population recovers, their distribution and calving habits are becoming more visible, indicating a potential shift in their migratory patterns. While some calves are now being born during migration, the reasons for the whales' continued migration to traditional breeding grounds remain unclear. This suggests that further research is necessary to fully understand these changes. The study emphasizes the need for expanded protected areas and awareness campaigns to safeguard vulnerable humpback whale calves, many of which have been observed with injuries. Dr. Adelaide Dedden from the New South Wales National Parks and Wildlife Service pointed out that while legislation exists to protect humpback whales, there is a lack of public awareness regarding calf sightings on migratory routes. Researchers caution that while these observations suggest a trend, more comprehensive studies are needed to confirm the implications of these findings on conservation efforts. Angus Henderson from the University of Tasmania noted that the increased sightings could signify the recovery of humpback whale populations since the end of industrial whaling, but also raise risks of conflicts with human activities. Dr. Tracy Rogers highlighted that calves born along migration routes must swim long distances shortly after birth, making them particularly vulnerable to human-related threats. Public education on maintaining safe distances from mother-calf pairs is crucial, with guidelines recommending a distance of 100 meters from adults and 300 meters from mothers with calves. Historically, humpback whale populations have rebounded to around 50,000 individuals due to conservation efforts, but the emergence of new calving locations indicates a need for updated protective measures. Researchers at the University of Arizona have achieved a remarkable milestone in quantum computing by developing the world's fastest petahertz quantum transistor. This innovative device utilizes a modified graphene phototransistor combined with a silicon layer, operating at an astonishing rate of 638 attoseconds. Associate Professor Mohammed Hassan highlighted the significance of this breakthrough, noting how it addresses hardware limitations that have not kept pace with the rapid advancements in artificial intelligence software. If this technology is successfully commercialized, it could revolutionize computing architecture, drastically reducing processing times in critical fields such as artificial intelligence, cryptography, and molecular modeling. The light-based transistor technology is currently being prepared for commercialization through Tech Launch Arizona, targeting applications in artificial intelligence, space technology, and medicine. Importantly, this new transistor operates under normal room conditions, enhancing its viability for everyday electronics. Hassan is collaborating with Tech Launch Arizona to patent and market this invention, aiming to integrate the petahertz speed transistor into microchips for practical use. The research team, which includes experts from the University of Arizona and collaborators from institutions like the California Institute of Technology and Ludwig Maximilian University of Munich, initially focused on the electrical conductivity of modified graphene samples. During their research, the team made an unexpected discovery of a tunneling effect that allows electrons to bypass barriers, significantly enhancing current flow and accelerating data processing. This breakthrough could enable computer processing speeds in the petahertz range, exceeding the capabilities of modern computer chips by over 1,000 times. This development is particularly relevant as it addresses the widening speed gap between rapidly evolving software technologies and the slower advancements in hardware, especially in artificial intelligence. Hassan advocates for leveraging quantum discoveries to enhance hardware capabilities, aligning them with the swift progress seen in artificial intelligence software. A recent study published in Nature Communications details how this technique could enable processing speeds in the petahertz range, significantly surpassing current computer chip technologies. Heart transplantation remains a vital treatment option for patients with end-stage heart failure, but a significant challenge looms. Less than half of available donor hearts are actually utilized. This underutilization is largely due to the limited storage times of donor hearts, which, when stored in cold conditions, experience cellular stress and inflammation. This process can lead to primary graft dysfunction, affecting nearly 20% of recipients and contributing to over 1/3 of post-transplant deaths. Researchers from Michigan Medicine and the Mayo Clinic have made a notable discovery regarding the molecular processes that damage donor hearts during cold storage. Their study reveals the role of the mineralocorticoid receptor, or MR, which exacerbates cellular damage by clustering and increasing stress on cardiac cells. This clustering leads to inflammation and oxidative stress, significantly impairing the heart's ability to pump effectively after transplantation. The phenomenon known as phase separation causes the MR to auto-activate, further worsening inflammation and oxidative stress, key contributors to primary graft dysfunction. The findings from this research highlight an urgent need for innovations in organ preservation to enhance the quality and resilience of donor organs during transport. In a promising development, the researchers found that treating human hearts stored beyond typical preservation times with Canrenone, an existing diuretic, nearly tripled their pumping strength and improved blood flow. By injecting Canrenone into cold preservation solutions, they were able to prevent MR clustering and significantly enhance heart function after 4 hours of storage. This suggests that Canrenone could potentially extend the preservation time of donor hearts beyond current limits, improving outcomes for heart transplants. Furthermore, the implications of this research may extend beyond just heart transplants. Similar protein clustering has been observed in other organs such as kidneys, lungs, and livers, indicating a potential for broader applications in organ preservation. Led by cardiac surgeon Paul Tang, MD, PhD, this study was published in Nature Cardiovascular Research, emphasizing the critical importance of preserving donor organ quality during transport. Researchers at Mass General Brigham have unveiled a new liquid biopsy blood test named HPV DeepSeek, which boasts a remarkable 99% accuracy in detecting HPV-associated head and neck cancers. This innovative test was evaluated in clinical trials involving 152 patients diagnosed with HPV-related cancers, alongside 152 healthy controls. The results revealed that HPV DeepSeek significantly outperformed traditional biopsy methods in terms of sensitivity and accuracy. Current standard detection methods for HPV-related cancers often fall short, lacking the sensitivity needed for early diagnosis. This limitation can lead to later-stage diagnoses, where treatment options become more aggressive and carry severe side effects. HPV DeepSeek's ability to identify cancers at their earliest stages could mean that patients may require less aggressive treatments, potentially minimizing side effects. Preliminary studies indicate that HPV DeepSeek has the capability to detect cancer up to 8 years prior to a formal diagnosis, presenting a significant opportunity for early screening. Dr. Daniel Faden, the study's lead author, noted that the test aims to provide a minimally invasive and more sensitive diagnostic option, which could enable earlier treatment and reduce adverse effects. These advancements in liquid biopsy technology, particularly with HPV DeepSeek, mark a pivotal step towards personalized cancer care and the early detection of HPV-related cancers. HPV is responsible for approximately 70% of oropharyngeal cancers in the U.S., a type of cancer that has been rising in incidence without any current early detection tests available. The research team is conducting additional studies to further assess HPV DeepSeek's effectiveness in screening and monitoring residual disease post-surgery, which could play a crucial role in informing treatment decisions. The findings on HPV DeepSeek were published in Clinical Cancer Research and presented at the AACR Special Conference in Cancer Research in 2024, emphasizing the clinical implications of this breakthrough. In addition to HPV DeepSeek, another promising assay called Maestro has emerged, showing potential in detecting residual cancer in non-HPV head and neck cancers, highlighting ongoing advancements in cancer diagnostics. City of Hope is sounding the alarm on a concerning trend: the rising rates of cancer among younger women. This prominent cancer research and treatment organization is advocating for immediate action to combat this alarming increase. To tackle these rising rates, City of Hope is recommending that breast cancer risk assessments begin at age 25. They emphasize that early detection is crucial and should be based on individual genetic and lifestyle factors. In addition to these recommendations, City of Hope is actively participating in the Phase 2 I-SPY-2 trial. This trial focuses on developing personalized therapies for high-risk breast cancer patients prior to surgery, which is essential given that women under 40 are significantly underrepresented in clinical trials. The organization also highlights the need for comprehensive supportive care that addresses the holistic needs of cancer patients. This includes considerations for fertility, mental health, and family dynamics, particularly for younger women who may face long-term survivorship challenges. City of Hope has identified 3 key areas for change: establishing a national standard for supportive care, expanding risk assessments, and prioritizing age-specific research. Survivors of cancer have underscored the vital role of self-advocacy in healthcare, especially when symptoms are overlooked or misdiagnosed. They stress the importance of trusting one's instincts when experiencing persistent or worsening symptoms, advocating for a more proactive approach to health management. This has been your daily brief in science. To read more about these stories, follow the links in the episode bio. You can also subscribe to these updates via email at www.brief.news. For more daily podcasts about the topics you love, visit brief.news/podcasts. Tune in tomorrow. We'll be back with everything you need to know.